Welcome back to White Coat Medicine Talks. This is Dr. David Cruz. Today we're going to be talking about another issue that is very important, and as our population gets older, it's becoming even more important. It's called dementia and Alzheimer's dementia. There's different types of dementia, but we will focus on it as a whole, and so that we can understand a little bit better. There are many studies that are going on to try to understand this better. As of now, there's no cure. And just because there's no cure, that doesn't mean that there's no hope, that we have to keep on going forward and trying to get everybody to do as best as they can. There's different issues and different topics that we can cover with dementia. But I think, first of all, we want to cover, that, what's going on with the brain. And we want to know what we can do to make the brain better. Through research, we have learned that there is what is called neuroplasticity, that the nerve cells do change and they can regrow and they can make new connections. And so that is what we need to focus on, and that is what we'll focus on. So first of all, what can we do to kind of help our brain? So the simple things, first of all, is making sure that a patient sleeps 8 hours a night. That is very important. It helps to clean up the brain, rest the neurons, rest the brain, and you'll do much better that way. For those people that can fast and not eat for 12 hours a day, that really helps to clean up the brain a little bit as well. And also the biggest thing also is exercise. 30 minutes a day, as active as they can get, will also help the brain. So those are some of the things that we need to work on every single day. Also, as a doctor, then we need to work on what we would call decreasing inflammation, or things that are going to hurt your neurons or your brain cells. And so we want to decrease inflammation, and by that we follow different markers. There is a C-reactive protein enzyme that we can draw that tells us that there's a lot of inflammation. Now there's different vitamins that can help us decrease the C-reactive protein. There's also something that we need to do is to improve the sensitivity of your cells in your body to insulin. When we do that, we also help decrease inflammation throughout the body. And also we want to help the mitochondria, which are the parts of the cells that make most of the energy for your cells. We want to help the mitochondria live longer and make more energy. So with this in mind, there's going to be many medications and many vitamins that we're going to talk about over the next several videos, so that we understand it a little bit better. Now, there is on neurons what we call a amyloid precursor protein. It is on the cells of neurons, and it's in the membrane of the neuron. And when that breaks down, you can either help neurons make more connections, or if it's broken down in a different place, then it's going to cause some cell death as well. So if you break it down in the alpha area, then you're going to make new connections. If you break it down in the beta area, then you're going to form possibly amyloid plaques and cause the cells to die. So it's very important that we give nutrients that are going to help break down this amyloid precursor protein in the right area. And so those are some of the vitamins that we're going to talk about also that may help this, that have been studied. One other thing that we try to do in the body is to decrease the stress in the body. And the protein that is associated with that is the steroid cortisol. Cortisol is made in your adrenal gland, and it has many good functions in your body, but is also associated with stress, and we try to control the cortisol level. So as the videos go on, we're going to talk about these different things: inflammation in the body, the amyloid precursor protein breakdown, and also the insulin sensitivity, and how to improve your mitochondria to live longer. And those are the main focuses that we're going to be doing on these videos. In addition, we're going to talk about the care of the individual and who to turn to if you need more help. I know that dealing with a family member that has Alzheimer's dementia is very difficult, and we hope to try to help you understand this better so that you can talk to your doctor and try to get a better treatment for your family member or your friend. So for today, I think there's only two things that I'm going to mention today as far as vitamins and supplements. In the clinic, we do a lot of vitamin D testing, and we have found that vitamin D is lacking in many patients. Now, vitamin D is good for many things, but it's good for your brain as well to make neurotransmitters. Neurotransmitters is how your cells and your brain communicate back and forth. So it's very important to make sure that your vitamin D levels are checked and that you have a good level of that in your body. The other medication I'm going to mention very quickly is citicoline, Citicholine. Citicoline is also a supplement that can be given. It's very good at making connections in your brain, especially after a person has a stroke. So citicoline might be something that you may want to talk to your doctor about also, and see if that is something that is right for your patient or your family member. Do not be afraid to bring it up with your doctor as far as if you start seeing any type of memory loss or any loss in functioning, because the earlier we start treatment, the better, and then you can start making lifestyle changes that will hopefully help the patient maintain a better memory for a longer period of time. For White Coat Medicine Talks, this is Dr. David Cruz, and we'll see you soon with the second talk on dementia.